Thank you very much. Have some nice day, everyone. Keeping well in this winter. Thank you very much for coming in this cold evening. Saturday, I think we are a great start. First of all, can I welcome you to the CEO of Local Airlines to introduce the panels and this industry.
Thank you. Thank you, sir. You've just promoted me. I'm not the CEO of NCA, but I am the Chief Officer for Rochdale Care Organisation that covers Rochdale Infirmary and all of the community health services in the town. So I just want to start by saying thanks to Sahel for asking me to come back and open the event today. This is the second event. The first one was just before Christmas on diabetes. Today's event's all about keeping well in winter, so looking at winter illnesses, and I'll introduce some speakers in a minute. I just wanted to firstly say thank you for coming out tonight. It's really treacherous out there, and it's very, very cold. So thank you for taking the time to get dressed up warm and come over to the community centre. Really, really appreciate it. A couple of things different from the last time when we met. You'll see the camera, we're being videoed, and I believe this is going to go on YouTube for people to watch at a later date. So that's fabulous that we can get the messages out today to a much wider audience. So thank you for putting the effort in and arranging all this, and to the chap there that's managing the camera. Brilliant. Okay. One of the roles I've got is Chief Officer for what's something called the Local Care Organisation. Now that is an organisation that brings together all of the health and care providers across the borough of Rochdale. So that includes primary care, so your GPs, mental health services, so Pennine care staff, local authority staff, so social workers, alongside hospital doctors and community staff, with our community and voluntary sector as well. And one of the key aims that we have is to look at health promotion and health protection. How do we work with communities to look at how to make better decisions, how to have a more healthy lifestyle, and you know, trying to invest really upstream in keeping people well and healthy. And part of today's discussion, hopefully in presentation, is going to cover some of that. The other thing that we're really keen to do is get into communities, to speak to communities and get our clinicians alongside local people in local communities talking about things that are of concern to them, and engaging in communities in a way that's meaningful and has added value. And I think today's event is a really good example of just that, and thank you to Sahel and Tariq and other people that really do put the effort in to bringing people together and arranging for people from healthcare to come and talk tonight. It's really, really exceptional, and I think they at some point in the proceedings they deserve a round of applause. So I'll perhaps start that now. So we'll just have a quick round of applause for Tariq, Sahel and the team. We're supported again tonight, as we were last time, by Genes for Health at the back there, and I would really encourage you to go over, have a chat, find out what that's about, and get involved. It's a really important piece of research, and we just thank you again for supporting the event tonight. And for Living Well, so Living Well is our local health and wellbeing offer for Rochdale. They are fastidious in turning up at every single event. They're always here, really committed to the work that they do. So again, here tonight, I wanted to talk about cholesterol and I want to talk about blood pressure. So again, if you get the opportunity of a dinner later, please find the time to go and have a chat with the team there. They really appreciate it. So to the big events, we've got two speakers this evening. We've got Dr. Ruth Wiggins, who's a respiratory consultant working out of North Manchester General, who's going to talk to you tonight about winter bugs and winter respiratory conditions. And then following Ruth, we have got, where is he? Here we have, we've got Chris Dalton, who's the lead. He's a physiotherapist by trade, but the lead for something we call the Enhanced Respiratory Service in Rochdale. just been recently accredited, so a really highly well regarded service. And Chris and the team, and there's a number of the team in the room this evening, are going to talk to you about long COVID. And maybe make a bit of a plug for some other services that the team offer as well. So that I'm looking forward to that. So I'm going to hand over now to Ruth, who's going to take us through the slide deck and then hopefully some questions and answers, and then on to Chris. Thank you very much.
Double mic. Okay. Do I need to be in the middle so that you can see me? Yeah, okay, right, Ruth. So hi everyone, I'm Ruth. I'm a consultant at North Manchester. I grew up in Rochdale, so it's lovely to be back here. And thank you so much for inviting me to come and talk to you about respiratory viruses. So Steve just mentioned that Chris and the rest of the long COVID team are going to be talking after me, so thank you so much for coming, guys. I really, really appreciate it. And we've also got two doctors in the room, so Dr. Muller and Dr. Khan over here, who are here to help and talk to you and help to translate. So if there's anything that you don't understand that I'm talking about, I'm sorry, my Urdu is terrible. So please, they will hopefully be able to help explain a little bit to you. So if you want to ask any medical questions, please ask me, or you can ask one of them. Are you going to be next slide, please? Oh gosh, right, it's like Chris Whitty. So I wanted to kind of try and think about what you guys might want to learn from this event. So really just to talk about what types of infections cause respiratory kind of viral infections, what is a virus, how do you get a virus, who is at risk of viral infections, what kind of symptoms do you get if you have a virus, and what happens, can it be a serious thing? What do you need to do if you have a viral infection, and how can you protect yourself from viral infections? And then, as we've already said, we're going to talk a little bit about long COVID, what the definition is of long COVID, and what you can do if you do have symptoms of long COVID, and how we might be able to help you. So, infections. So, infections are caused by germs, and germs are can be lots of different things. So there are lots of different things that are germs. So bacteria are germs, viruses are germs, fungi are germs, parasites, things like ticks or mosquitoes or worms, those would all be counted as germs. And there are millions of germs, and we encounter germs all the time. Not all germs are bad. Germs live on our bodies, they live inside our bodies, and they don't always cause us to become unwell. But when a germ enters the body and it multiplies and it causes a reaction in your body, that's what we call an infection, and that's when we can become more unwell. Thanks, Chris. So viruses. So viruses are a type of germ, and viruses infect a living thing, so that thing is called a host, and they can't replicate on their own viruses, so they have to infect something, which is called a host, and then they have to turn their cells over, use that host cell to make more viruses. So they hijack the normal things in our cells, the bits of our cells that we use to repair our own cells. They hijack that normal machinery and they use it to make more viruses. So when a virus infects a cell, it hijacks your normal cell machinery, and eventually the viruses will break out of the cell and they will kill that cell. That's something called lysis. And when that happens, that means more virus can spill out into your body, it can cause more of an infection, but it also causes a reaction in your body, and things like little proteins and chemicals and things are released, and that can cause problems. So the other thing about viruses, which is very specific, is that when a virus invades a cell and it uses the cell machinery to make more virus, it does that very quickly. And when it does it very quickly, there can be faults in how that virus does that. So the virus might have a different spelling in the sentence of its DNA. And that can cause the virus to change. So viruses change very, very frequently and very, very quickly. That's a process called mutation. So that's something that's very particular to viruses. Another thing that's very important to know about viruses is they are not the same as bacteria. So they work in a different way. So antibiotic medicines that you might ask for or think that you need or take for an infection will not work against a viral infection. So antibiotics do not work for viruses. Okay. So the common winter viruses, so the things that I'm mainly going to talk to you about today, are these three things. So there's a virus called COVID, also called coronavirus, or COVID-19, that you've probably all heard of. There's a virus called flu, which is also called influenza. And then there's another virus which I'm just going to mention, which is called respiratory syncytial virus. So those three viruses are all very common in winter, and they cause a lot of winter infections. They're all respiratory viruses, generally, so they tend to cause problems in the airways, in your nose, in your throat, in your eyes, might cause some headaches and kind of flu-y symptoms, muscle aches and things like that, or you might get more of a chest problem, so a cough or breathlessness or wheeziness. There are other common infections in the wintertime, so things like norovirus, that's not a very nice infection, which causes diarrhea and vomiting, and lots of infections tend to be common in the wintertime, but I'm just going to talk really about those three. So there's a very short video here which just says about how you catch a virus. Well, you'll have to open YouTube because it wasn't working before. So I'm just going to see if this works. So this video is just a quick video of explaining how viruses get caught.
When we breathe, talk, laugh, cough, or sneeze, we release droplets into the air. Some of these are microscopic and can remain floating in the air for an hour or more. Others are large, fly through the air briefly, and fall to the ground or other surfaces within seconds. If a person is infected with the virus, some of the droplets may contain viruses. The droplets also contain large amounts of salts and proteins and other chemicals that are in respiratory fluid. If the air is not very humid, some or all of the water in the droplet will evaporate, leaving behind a smaller droplet that is about half the original size. From research on flu patients, we know that at least half of the viruses that are expelled into airborne droplets are found in those smaller than 5 microns, which can remain floating in air for half an hour or more. During this period, they may be carried by air currents many meters from the person who released them. But this process also dilutes them in the air, reducing the chance that you could breathe in a lot of them. Viruses and droplets that land on surfaces and in the microscopic ones that float in air break down over time and lose their ability to cause infections. How fast this happens depends on the type of virus and conditions such as temperature, humidity, and the type of surface material, whether it's cloth, paper, plastic, or metal. There are a lot of things we still don't know about viruses in the air. We don't know how much transmission occurs through inhalation of such viruses versus them landing in our eyes, nostrils, or mouth versus touching them on objects. For most types of viruses, we don't know how many are found in different size droplets and how well the viruses survive under different conditions in the real world. What is clear is that for some types of respiratory viruses, Transmission at close range can occur through multiple routes, including direct spray of large droplets onto the body and inhalation of microscopic droplets.
So, hopefully that clarifies a little bit how we get viruses. Although I think it's fair to say that we probably don't know a lot still about how viruses are transmitted. Oh, YouTube's still on. And a lot of the kind of controversies around viruses in COVID were related to not understanding a lot about how viruses are transmitted. So, thanks Chris, sorry. Coming back to the middle. You might have to skip again, thank you. So, who is at risk from winter viruses? So we've talked about some of the common things. Now it's important to know who is at risk of getting these illnesses. So I think it's fair to say that anybody can get a virus, and we all have viruses, and it's very, very common for us to get viral infections. And especially if you live with small children or you have a lot of contact with small children, you will know that you will be frequently getting kind of things like colds and sniffles and sore throats. But there are some groups of people who are at a higher risk of becoming more unwell with viruses. So there are some things that are physical factors that mean that we're at higher risk of viruses. So that's people who are very young, so under the age of 5 or older, over the age of 65. People who have other health problems, in particular people who have lung problems like COPD and asthma, people who have heart problems like you might have had a heart attack or have heart failure, if you've ever had a stroke, if you have diabetes. Pregnant women are at risk of viral infections too. People who have cognitive impairment, people who have reduced mobility or are not as mobile or who have a history of falling. So those are the physical things that might increase your risk of having viral infections. But there are also some things in our environment that might increase your risk of getting a virus, of becoming more unwell with a virus. So if your home is cold or if it's damp, if you don't have enough heating, if you don't have anywhere to live or you sleep outside, if you have a poor diet, if you smoke or you live in a house with somebody who smokes, and some people who work in certain jobs are at risk of viral infections. So if you work in healthcare or social care, or if you work in another job, like you're a teacher, or you work in a job where you're encountering a lot of people in a confined space, we tend to see a higher risk of viral infections. And from South Asian communities, we know that there are a lot of people in the community who have things like health problems that might predispose them, make them have a higher risk of becoming more unwell with a virus like flu or COVID. Thanks, Chris. So what symptoms do viruses cause? We've talked a little bit about this already. You will have all had viruses, so you'll know that the common things are things like itchy eyes or a runny nose or a sore throat. You might feel a bit tired or a bit run down. Some people might have a cough, you might have a temperature, you might have a headache. But if you've ever had a really bad flu or COVID, really serious COVID, then you might have a very high temperature. You might have sickness, you might not be able to eat, you might lose weight, you might have muscle aches or feel extremely fatigued, feel very, very tired. And these symptoms can go on for several days, even weeks. With COVID, there are some specific symptoms, and I'm sure the long COVID team might talk about them in a bit more detail, but there are some things that we know with COVID, like you might have lost your sense of taste or smell if you've ever had COVID. So can viral infections be serious? So I think most viral infections are very mild, and most people get better without any treatment at all. But for some people, they can become very unwell with viral infections, and sometimes viruses can cause a condition called pneumonia. So pneumonia means we can see a patch of infection on an x-ray. That's what a pneumonia means. So if you become very unwell with the viruses, then you might need to come to hospital. Sometimes if you're very unwell, people need to be supported with breathing. They might need a ventilator in intensive care. And sometimes people can die from viral infections. And one of the reasons that we worry about viruses is because they're so common that even though most people get better with viruses, because they are so common, the number of people who come to hospital with viral infections is still quite high. So the other thing to say about COVID is that we know that some people who have COVID may have symptoms for many, many months after they become unwell with their COVID infection. So that's another potentially serious thing that can happen to people after they've had a virus. At the moment, about 3% of people in the whole of the population of England and Scotland have COVID. About 10% of people in the whole of the population have flu, and about 5% have this other virus called RSV. So that's quite a lot of people. So that means that you're likely to have contact with people who have these infections. So how has COVID impacted South Asian communities in the UK? I think it's important to say that the pandemic didn't affect all parts of the population equally, and we know that people who are from South Asian communities had more infections, they were more likely to become unwell, and they were more likely to die, unfortunately, of COVID. And you may well have had friends or relatives who died because of COVID. And there are lots of reasons for this. There are some reasons, like I've explained, because of the risks of becoming unwell with a virus. There are some reasons about living with lots of people in a house that would increase your risk of getting the virus, the types of work that people do, and also access to healthcare, vaccination, and kind of other reasons why people may not have received equal treatment who are from a South Asian background. And there are other things that have impacted the community disproportionately in a different way than other ethnic groups in the UK. So there is evidence to say that people's mental health, if you're from a South Asian community, might have been made worse by COVID, and also things like physical health. So through not being able to speak to your doctor, or not having regular checkups, or having to wait a long time to be seen, and other things like that. So what should you do if you become unwell with the virus? So my dad has helpfully managed to fix these, which I bought off Amazon today. So I'm going to give you them and pass them around. So this is an oxygen meter. So you can put this on your finger and check what your oxygen levels are. You just press the button here and it tells you what your oxygen levels are. So it should be something between 94 and or above. Anything above 94 is okay. So we sometimes use these to decide how poorly somebody is, and I'm sure Chris remembers that when we were discharging people from the hospital with COVID, we used to give people these and see how their oxygen levels were. So I've said this a number of times, but most people who have a virus have mild symptoms. So if you've just got a bit of a cough or a headache or a low temperature, then we would suggest that you take lots of fluid, so at least 6 to 8 glasses of water a day. You can use normal pain medicines like paracetamol or ibuprofen for your temperature. If you are in an at-risk group for COVID, then the advice is still that you should do a test, a COVID test. And then you can speak to your GP or phone 119, which is the vaccine helpline, because you might be able to access some treatment for COVID. So there are some very particular treatments, not antibiotics, but a bit like that for COVID. And there are also treatments for influenza, which, again, if you are in an at-risk group, you would be able to get. So if you're in one of those groups that I was telling you about before, you've got health conditions, you're over the age of 65, you're pregnant, we would usually suggest that you speak to a healthcare professional, even if you've only got mild symptoms, because you might be able to get some treatment. If you were getting worse, so your symptoms had not been getting better, they were going on for days and days, you're coughing up phlegm, you've got a higher temperature, you can't eat and drink, it's really important to make sure that somebody's checking up on you if you live on your own, or if you know somebody's in this position and they live on their own, just to check up on them. You can speak to your pharmacist and they might be able to help with some other medicines, and also you could make an appointment with your GP. But if you're becoming a lot more unwell, so you're very breathless even when you're resting, you're finding it difficult to take a deep breath in, you've got chest pain, if you're cold, you're clammy, your skin is changing a different colour, your lips or your face are blue, if anybody is then they're not behaving normally, so their behaviour has changed, or they're more sleepy than usual, that is an emergency, and we would always suggest that you speak to a healthcare professional as an emergency. So call 111 or call 999 or come to A&E, because you could have a very serious viral infection. So what can we do to protect against viruses? So I'm so glad they've put these posters up at the back. So Deeplish Community Centre is a warm space, so there are spaces within Rochdale that you can go to, where community spaces where you can keep warm, you can have a cup of tea, you can seek advice about heating and about bills, energy bills and things like that. So that is really, really important, and I would really encourage you to speak to the people from the centre if you're worried about anything like that. Making sure that you're drinking enough fluid. Carry on staying active if you can, and even if that's just up and about making a cup of tea or going upstairs to the toilet, that's really, that all little bits are helpful. And if you can, or anybody in your house smokes, then stop smoking, because we know that that can increase your risk of getting a virus. To try and reduce the spread of viruses, you can wash your hands regularly, cover your face if you're coughing or sneezing, and if you know somebody is at risk of becoming unwell with a virus, then, and you have a virus, you can maybe try and avoid seeing them, if you can, for a few days until you're feeling better. And you can prepare to have viruses, because you know that it's very common, so you can have simple medicines in your medicines cabinet and make sure that all of your medicines that you're supposed to take from your pharmacist are all up to date. But probably the main thing that you can do to reduce the risk of becoming unwell with a virus is to have a vaccine. So we're just going to talk very briefly about that. There's a super quick video again about vaccines. Thanks, Chris.
Well, the COVID-19 vaccines work just like any other vaccine you may have had. Vaccines train our immune system to make antibodies and cells to fight the infection. The vaccine does not contain COVID-19 and cannot give you the virus. The vaccines do not contain anything that has come from fetuses or animals. The vaccine does contain a minimal amount of ethanol, but less than you would find in a banana or slice of bread. So they are suitable for those who wish to avoid consuming animal products or alcohol because of religious, cultural, or dietary reasons. More and more religious leaders and organizations are encouraging people of faith to get the vaccine. You can find the list of ingredients in the approved vaccine on the NHI website. For the facts on the hashtag COVID vaccine, visit www.nhs.uk/coronavirus.
So that's a bit of specific information about the COVID vaccine. But in general, the principle is the same. Vaccines often contain bits of the virus, or bits of the virus that we're trying to vaccinate against. And when they are put in your body, they create a response in your body, an immune response. And that means that if you then get exposed to the virus in real life, your body already has some memory of that virus, so it's better able to fight the virus off. So, should you get a COVID or a flu vaccine? So these are the people who are currently recommended to get a vaccine for COVID and flu. And you'll notice that it's a lot of the same people who are at risk of becoming seriously unwell with these viruses. So if you're over the age of 65, if you've got a health problem, if you're pregnant, if you work in a high-risk job like you work in health or social care, if you're a carer, if you live in a care home, or if you are somebody who has an underactive immune system, or you live with somebody who has an underactive immune system. So if you fall into any one of these categories, then we would recommend that you get a vaccine for COVID and for flu. Children are also eligible for the flu vaccine as well. So all school-age children from reception to year 11 are offered a flu vaccine. Children aged 2 to 3 are also offered a flu vaccine. And then there are other children who are slightly outside of those age ranges, if they have certain health conditions, who are also offered a flu vaccine. So there are slightly different rules for children and flu vaccines, but they should all, hopefully, if you have children or grandchildren, have been offered a flu vaccine through school. Thanks, Chris. So, is the vaccine going to make you unwell? So it's quite common to feel a bit poorly after you've had a vaccine. So common symptoms to get after you've had a vaccine are you feel a sore arm where the needle goes into your arm. You can feel some of the symptoms of the virus. So you might feel a bit tired or have a headache or have achy muscles or feel a bit fluey, have a bit of a temperature or feel a bit sick. But very serious side effects are very rare. So probably the most common serious side effect for the COVID vaccine is something called anaphylaxis or an allergic reaction. And that is definitely seen, but that's very, very rare, less than 1 in a million people. And there have been some other very rare reports of things like inflammation in the heart muscle, which can happen after the COVID vaccine. But again, those side effects are extremely rare, and millions of people have had these vaccines safely. Are there concerns around the vaccine? So some of the things that you might hear of are that the vaccine doesn't work. So vaccines don't stop you from getting an infection, a viral infection. So if you have a COVID vaccine, you can still get COVID. I mentioned earlier on that the viruses change very frequently because they are constantly replicating in your cells, so they can do this thing called mutate. And that means that the vaccines have to change as well, because the virus is constantly changing. So because of that, sometimes the vaccines are not 100% perfect for that virus. And but the main thing to say really is that the vaccines reduce the risk of you becoming very seriously unwell. So certainly in my job, I don't see people coming to hospital with very severe COVID anymore, anywhere near as much as we used to, and that's because of the vaccine. So there's other things that people have said to me about worries about the vaccine. So there wasn't enough research done about the vaccine before it was rolled out. And it is, obviously the vaccines were developed especially for COVID very, very quickly in a year, and that's very rare, that's never really happened before, but because everybody around the world was trying to create a vaccine for COVID, there was a real community effort trying to kind of pull together to create this vaccine to help people. And the vaccines went through all of the same processes of checking and safety that any other medicine or drug would have to. And there were other things that people have said to me about the vaccine, worrying about the vaccine changing your monthly cycle, so if you're a woman. So there is something about COVID that maybe does and can do that. It can affect your monthly cycle, but we don't really know why or how. Certainly, I don't know if you guys see this very much in the long COVID team, but there's been issues around the menopause and COVID inducing menopause in women. So if this is a problem for you, and it's quite a common problem, then we would really suggest that you speak to your GP about it, because there are treatments if you are having symptoms related to the menopause, so things like sweats or dryness or changes in your mood, that we can treat, and we can give you hormones to treat that, and it's something that's not really discussed very much, so we would really encourage you to speak to your GP about it if you want to. So, how can you get a vaccine? This is my last slide. So you can speak to your local pharmacist. So they're the best people probably to speak to. And the local pharmacist in Deeplish, I think, do vaccine clinics, and they can either arrange for you to have a vaccine or they can refer you for a vaccine. You can speak to your GP. There's a phone number called 119, which is the vaccines helpline, which you can ring, but I don't know if anybody will answer. And you can go to a walk-in vaccination clinic. So there's the Gateway team. This is based across the whole of Greater Manchester. There's a phone number there, so you can have that afterwards if you're interested in getting a vaccine, or you can go to a walk-in clinic. I don't think there's one in Rochdale in the next week, I didn't check, but there's some in Manchester. But you should be able to get one through your GP or your local pharmacist. So I'm going to hand over to the non-COVID team now. I think we'll just all wrap up at the end, if that's all right. Yeah? Okay. I'll do you.
Thank you.
Oh yeah, hang on a minute, sorry. Yeah. Thank you.
Okay, everyone can hear me okay? Brilliant. Thank you. My name is Chris. I'm a lead physiotherapist over at the Enhanced Respiratory Service, which is on your doorstep at Rochdale Infirmary. So, yes, I'm going to talk about post-COVID syndrome, but I thought I would plug our service a little bit as well, to all of you here and at home as well. So, as part of the Enhanced Respiratory Service, we are here representing a whole of specialists, a whole team of nurses, physios, we have psychologists at the back, occupational therapists at the back, they're putting their hands up, so speak to them after if you need to. Hetal as well, another nurse here taking a photo of me. So yeah, the service is huge. For anyone who is familiar with the condition COPD or bronchiectasis, if you have a confirmed diagnosis of that, we have a team of nurses that see people at home 7 days a week. If anyone's got a chest infection, they will go and see them at home and make sure you get better, give any advice, treatment, antibiotics, anything that you need to keep you at home and get you better. We also have a pulmonary rehabilitation service. It's called Keep Active, Breathe Better. So it's an exercise class for people with any lung condition or lung disease, which is a big part of our service. And we also have the post-COVID syndrome service as well. So last year, we really focused on building the quality of our service. And as Steve introduced at the start, we have just been accredited to the Royal College of Physicians, and only 12 services in the whole of the country have achieved that so far. So we're a really high quality service, trying to do the best we can for the people that come and use our services. Last year as well, we also won a Customer Experience Award for the whole of Salford, Rochdale, Bury and Oldham. So again, it just shows the commitment that we have to put patients at the heart of everything we do. And last year, I presented quite a few times, not with the mic in my hand or being on YouTube, but I did present to GPs. There was over 50 GPs in one room, to practice managers and to nurses who work in the GP practices, to get our message out of what our service actually does. So now we've done all that, and now our focus is with you guys to get our message out to the general public. So being given the opportunity to do this by Sohail and Tariq is fantastic, and we honestly hope that this is the first of many opportunities we get to come out and speak to the communities across Haywood, Rochdale, Middleton, Castleton. We'll crack on with post-COVID syndrome. So with the GPs as well, we did ask, how do we engage with our communities more? In their opinion, what would be better? And it is coming out into services like into community halls like this, having translation, which I've put on the slides here to hopefully engage more with yourselves, and just we want to use every opportunity we can. So post-COVID syndrome, if you think of acute COVID, which Ruth did talk quite a lot about with regards to an acute infection, that's within like the first 4 weeks of having COVID. It's acute COVID, it's made you generally unwell, and hopefully within that 4 weeks things have got better, you've recovered, and you've gone back to normality. There is an ongoing symptomatic COVID, so that's kind of symptoms are lingering 4 to 12 weeks. And then we get into the category of post-COVID syndrome. So this is off the NICE guideline. It's the National Institute of Clinical Excellence, which develop a lot of guidelines that the NHS use, and this is their official definition. So it's signs and symptoms that develop during or after an infection consistent with COVID-19 that continue for 12 weeks or more. So the symptoms that you had initially when you first got COVID, they've not fully gone away, they're still lingering, they're still causing you problems, and that's when it comes into post-COVID syndrome. The public, social media, they kind of developed the term long COVID, which is much more wider known than post-COVID. In the healthcare professional side of things, we deem it as post-COVID, but the general public say long COVID, and it's kind of like the same thing. Thanks. So just another little bit of background about us. We've been a post-COVID service since March 2021. We've seen over 550 people come through, and the good thing about our service is that we see people face to face. There are services that are set up and they're just over the phone. We do see people face to face, and I'll come on to that in much more detail later on. We were using evidence-based practice at all times when COVID first hit. There was no evidence, everything was evolving, and there were many times when I first started and I was seeing people in front of me where I actually said, I don't know why you're feeling like this, because it was all new. But now slowly over more time of seeing patients, we're learning so much and how to treat things. Thank you. And with that, the three most common symptoms that we do see coming through in the clinics, and this is not just in Rochdale, this is kind of nationally, has been fatigue, breathlessness, and this brain fog. Brain fog meaning that you can forget people's names, you can forget why you walked into a room to get something and stuff like that, and it can really get people anxious, it can really get people down about, oh, what's happening, why am I changing like this? These are the three main symptoms that we see coming through on a regular basis. There's an app that has been created for COVID-19, and in that app we ask people to kind of log what their symptoms are, and this is for the central Manchester area, or Greater Manchester, sorry. These are the common symptoms that were being logged by people just purely off a questionnaire and what they were experiencing. So we've got fatigue, pain, issues with functional daily tasks, anxiety, problems with cognition, memory, breathlessness, cough, breathlessness at rest, feeling low mood. There's so many symptoms. It's not just where you go to a GP and you might be only allowed to talk about one thing. With us, there's lots of things. It's kind of impossible in the realms of post-COVID syndrome that we can just talk about one thing. It's very rare that I've met one person who's just got one thing going on. There seems to be a big cluster of these symptoms. So what we did as a team, recently we set up a little bit of a project where we tried to tackle these most common symptoms by looking at what skills we have as professionals, me being a physio, psychologist, occupational therapist, and how we can help people that come through to our service the best we can. Thanks. See ya. Again. So we focused on these, and then again. So we can split them up into a physical aspect, and we can also look at the mental aspect, and there's a big crossover between the two, and it's really important that we look at that. And I think when we first started the post-COVID service, there was a lot of people that would come through and say, I think it's all in my head, or people are dismissing me, they're saying it's not real, these symptoms are something else. And so many people felt like when they came in front of us that they were a fraud sometimes almost. But these symptoms that the people are experiencing were really real, and it's how we address these. So there's a big correlation, this slide, thanks to Rachel. This just shows the correlation between physical and mental health, that there's a big crossover in this area here. How our mind is thinking can impact what our body is thinking as well, and what's happening there. So we can't dismiss the crossover between the two, and this is what we try and do in our service. So by physio, occupational therapy, and psychological medicine. So we're trying to do like almost a three-pronged attack on treating the symptoms the best we can. Thank you. So physiotherapy, what do? I basically will look at your lung function. So people think of physios as knees and backs and stuff like that, but no, we do lungs, we do many different things, and one of them is specialising in lungs. So we can assess your breathing. A lot of people have cough, a lot of people have a change in their breathing pattern. We don't think about our breathing generally on a day-to-day basis, but it's the first thing we have when we enter the world, and it's the last thing we have when we leave the world as well. But our breathing pattern can actually change, and that can change by physical means, and it can also change by mental means as well. Like if we're anxious, you don't tend to breathe calmly, you breathe quite fast, and that has a massive impact on how we breathe on our body. So we work on that. We will work on exercise if we need. Everyone knows there was a big time when we were all isolating, stay home, stay safe, and a lot of people generally deconditioned in that time as well, not exercising, not going to the gym. Many services, many gyms were closed. So just working through that as well. And we can also arrange special tests. So yes, we are health professionals and allied health professionals, as their official term, but we have access to doctors like Ruth, specialists, consultants, you name it, we can get special tests done and explore further to try and get the best treatment for you to make you feel better. Moving on to occupational therapy, we've got Laura and Lauren at the back. I won't call you both up, but yeah, they're occupational therapists. They specialise in managing fatigue. managing, they can give you advice on how you're managing your activities of daily living. They can look at how if you need any specialist equipment to help you in any of your tasks. They can look at sleep. There's so much occupational therapists do. I can't sing their praises highly enough. So it's really, really good to have them on board on the team as well. And then psychological medicine. So yeah, so much again with regards to the psychology. So a team, they help you live alongside your COVID symptoms, offer group therapy, one-to-one therapy, focusing on your functioning and your overall quality of life. And again, like I've already kind of touched upon, the cross between the physical and the mental aspects of how you're managing your life at the moment. So yeah, I can't sing enough praises about the service, really. There is a really good website. So this, if you're really good on the web, it's called Your COVID Recovery. So if you're at home, screenshot or take a photo of it now. It is fully translatable into any language, or lots of languages. Put the Urdu version up to show you. So it's just got self-tips, general advice, a lot of what Ruth was going through with you before on tips and stuff like that. It'll tell you what the common symptoms are and what you can do to self-manage. When it becomes more than that though, and things are worsening or not getting better, as Ruth touched upon before, then we do encourage you to contact your GP, because GPs, like I said, we've been out to them, they know about our service. It's you guys that maybe don't know about our service, but hopefully spreading this message it will. Contact your GP will then initiate a referral to us, and we act very, very quickly. At the moment, we will see people within less than 4 weeks. So we will see you very quickly, assess you, you'll have an initial telephone triage to go through your symptoms, and then 95% of people will come through and see us face to face, and we'll go through to see how we can best help you and put you on a kind of a treatment pathway to hopefully get you fully recovered off from your symptoms. Next slide. And again, just more kind of examples of what the website is about. So yeah, so again, thank you so much for allowing us to come and talk to you today. As I said, there's so many strings to our service that I would love to come back if you let me and you're happy and the sound quality is okay for me at all this lot. If you're happy, because like I said, pulmonary rehabilitation, the exercise classes, so if you have or know anybody in your family or any friends who have COPD or any condition like that, then I'm happy to come back and tell you about pulmonary rehabilitation. And with regards to COPD, again, unique to our service, we are setting up a study which actually starts on the 1st of February, and we're hopefully designing an exercise class specifically for the South Asian population. So again, that could be looking at how we design a class. Would it be a same-sex class? Would it be in a mosque? Anything like that? But again, we're trying to really engage with the local community and provide and just try and reduce health inequalities that we see all the time. We want you to access our services, definitely. Okay, so if I have more information about that, I'll just plug Amy. If you put your hand up, Amy. So yeah, Amy in the room has got a little poster on the study that we're looking at starting. It's ourselves in Rochdale, and there's Leicester as well. So Leicester are a really big service in terms of respiratory in the whole of the country. And again, another great scout for Rochdale is that we're being paired up with Leicester. So hopefully I've said enough about our service for you to know that it's a high quality service. And like I say, we're just on your doorstep, and spread the message basically. Thank you.
So hopefully that has been helpful, and you've all learned a little bit more about what viruses are and what we can do to prevent them, and a bit more about the amazing long COVID team in Rochdale and how they might be able to help you. Has anybody got any questions? Please feel free to ask anything. There is no question too small. Okay, I'm going to come over to you.
So, I just want to ask Ruth, obviously back in COVID days, we had to mask up and isolate. So what's the situation at the moment? What's the guidance that people need to put masks on, isolate, and so what is the latest information on that?
Thank you, that's an excellent question. So that was, do we have to isolate and should we be wearing masks? So no, you don't have to isolate any longer if you have COVID. In fact, in the hospital, we're not even routinely testing people for COVID any longer. In terms of masks, we know that probably the evidence around using masks is not particularly brilliant. But we know that probably the main benefit of wearing a mask is you reduce the risk of somebody else becoming unwell with a virus. So the main benefit of wearing a mask is to try and reduce transmission to somebody else rather than reduce the risk of you getting a virus. So if everybody wears masks all the time, it probably does help to reduce the transmission of viruses. Again, you don't have to wear them. Obviously, some people do wear them, and we do sometimes wear them in hospital, but it's probably going to help reduce the risk to others rather than to you personally. Does anybody else want to ask anything? Dad?
Well done on off on the mic, I'm sure it's just thinking out loud, as folks spend more and more time in more COVID, and therefore they're not able to work, or maybe even have been sacked or dismissed, or in some way had to resign, financial pressures and worries, I guess, emerged during your discussions.
Yeah.
How does the team respond to that, and what access have you got to offer rights, advice and support?
Yeah, so Laura's here as well. You can help with that. It is a big question that we ask, because if a lot of people with COVID, a lot of people, it's kind of get the infection and it can be life-changing. They can be 34 years old, working full-time, and then all of a sudden completely gone and dropped, and they can't get to work. Mixed stories, pressures of wanting to get back to work, pressures from the employer wanting them to get back to work, and there can be this kind of cycle of trying to get them fit enough but then not push them too hard, especially when it comes to fatigue as well, chronic fatigue. That certainly plays, and we always ask kind of like how anxious people are, the depression. And then with regards to like Laura helping up, we have kind of like we call it vocational rehab. So it's how we try and get someone back into work, trying to support them through like a return phase to work and stuff like that. And then certainly from a financial perspective, we link in with our kind of communities, and there's all these different citizens advice and stuff like that we can access to, and just provide as much support as we can, really. Is that okay? Yeah.
I'm actually doing a project about return to work and long COVID, Dad, which has been granted ethical approval last week. So watch this thing.
Very good.
Mr. Chris, you mentioned these COPD studies.
Yeah.
So can you explain this, or can you also tell us a bit more about it?
Yeah, of course I can, yeah. It's up to you, Amy. Yeah, Amy's going to step up, yeah.
I don't know if I can model it.
Thank you.
Hi everyone, my name's Amy Blakemore. I'm from the University of Manchester. I'm a lecturer in mental health actually, but I have a background in working with people who have COPD. So a condition that Ruth and Chris mentioned earlier, chronic obstructive pulmonary disease. You may know people who are perhaps older who have that condition, that problem with their breathing. And there's a really effective treatment for COPD that Chris mentioned before, which is pulmonary rehabilitation. But what we know is, when we've looked at the evidence and the research that's out there, is that access to pulmonary rehabilitation isn't always equal, and that people from South Asian communities are less likely to be told about pulmonary rehab and to be referred to pulmonary rehab. And when people are referred to pulmonary rehab, they may be more likely to drop out of the programme before they complete the programme. So the programme involves education about living and managing COPD. It also involves exercise. It can involve some psychological components as well, all to support you to live better, to breathe better and keep active, I think, as Chris said before. And what we really want to do is really understand what the barriers are that are keeping South Asian people with COPD from attending and completing pulmonary rehab. So we have a research project which is funded by the National Institute for Health Research, a government organisation. So we're really invested in this in terms of really understanding this and coming up with a better solution. So we're going to be working on this for about 18 months, starting in February. And what we're going to be doing is wanting to speak to people with COPD.
Sorry. Oh, do I have to wear it? Oh, sorry. Hang on. I'm just going to hold it because I can't. Will that work?
Yeah.
Okay. Where was I? We're wanting, so we're starting in February. And what we want to do is speak to people from the South Asian community who are living with COPD and understand their experience first of living with COPD, and understand if they've heard about pulmonary rehab before. If they have, then have they been referred? Has anyone ever talked to them about it? If they've been, how did they find it? Did they complete the programme? And what did they like about it? Or what would they like to see differently, done differently, that would help support more people from the South Asian communities to access pulmonary rehab? And we'll also talk to health professionals who deliver pulmonary rehab about the changes we can make to the programme. And we'll talk to kind of national, what we call key stakeholders or key informants from across the country who are involved in commissioning pulmonary rehab and writing the guidelines for pulmonary rehab, so that we can come at this from every angle, if you like. So by the end of our 18-month project, what we hope to have is a culturally adapted version of pulmonary rehab that's going to be more accessible, more acceptable, and easier for people from the South Asian community to access. And we'll also hopefully have developed a community engagement strategy to talk to more people from the South Asian community about COPD. So if people are starting to experience breathlessness and symptoms that could be COPD, then they're more likely to go and get those symptoms checked. They're more likely to perhaps have tests that might mean they're diagnosed with COPD, and then they can access this really effective treatment as well. So over the next 18 months, we'll be working with Chris's team, like you said, and the team from Leicester as well, to find people who have COPD who are interested in talking to us. So it may be that hopefully I'll come back at some other time and talk a bit more about this project, and also other research projects that we have ongoing at the University of Manchester, which often might be around other long-term conditions or mental health and psychological care as well, that we could talk about. We could perhaps do a seminar at some point. So I hope that was okay, just off the cuff. But thank you very much for the opportunity to come and meet everyone today.
Dr. Khan, do you mind just kind of, if there's any quick summary bits to sum up in Urdu, if that's all right, and then see if anybody's got any questions, and then if not, then we can adjourn.
Thank you. Thanks.
बिस्मिल्लाहिर्रहमानिर्रहीम, मेरा नाम डॉक्टर खान है और मैं एज अ लोकम जीपी काम करती हूँ रॉचडेल के एरिया के अंदर. सॉरी, No, I think I'll just hold it, yeah, because... Thank you so much, yeah, thank you. So मैं रॉचडेल एरिया में एज अ लोकम काम करती हूँ, कैसल्टन हेल्थ सेंटर में और कर्कहोल्ट एरिया में. So basically जो आज का ये सारा मीटिंग यहाँ पे थी, ये इसलिए थी कि आपके अंदर अवेयरनेस पैदा की जाए सांस की बीमारियों के मुतालिक और स्पेशली कोविड से मुतालिक. कोविड जो है ये हमारी कम्युनिटी के अंदर, जैसे साउथ एशियन कम्युनिटी को बहुत ज़्यादा अफेक्ट किया है. बहुत लोग बीमार हुए हैं और अनफॉर्चुनेटली बहुत से लोगों की फौतगी भी हुई है कोविड की वजह से. मतलब ये है कि आपके अंदर आगाही पैदा करने के लिए सांस की बीमारियों के मुतालिक, दमे से मुतालिक, कोविड से मुतालिक मोस्ट जो ज़्यादा इम्पोर्टेंट है. तो उसमें यह है कि आप अगर कोई भी इस तरह का आपको सिम्टम अलामात आ रही हैं कोविड की, तो आप अपने जीपी के साथ बात करें. और यहाँ पे बहुत ज़्यादा फैसिलिटीज़ हैं, बहुत ज़्यादा सर्विसेज हैं जो कि लॉन्ग कोविड के मरीज़ों के, यानी जिनमें वो मरीज़ जिनमें कोविड लंबे अरसे चलता है, उसके लिए बहुत सी सर्विसेज मौजूद हैं. तो आप अपने जीपी के साथ बात करें और कोविड की कोई भी जो अलामात हैं उनको आपने क्या कहते हैं उनको सीरियसली लेना है और उसके लिए मदद मौजूद है, हेल्प मौजूद है. तो आप अपने फार्मासिस्ट से बात कर सकते हैं, अपने जीपी के साथ बात कर सकते हैं. ठीक है, थैंक यू. अगर कोई क्वेश्चन है तो प्लीज़ आप बताएं. मैं डॉक्टर विगन से बात पूछ सकती हूँ अगर कोई क्वेश्चन है.
अगर आपको कुछ सवाल है तो डॉक्टर विगन से और डॉक्टर विश भी यहाँ बैठी हुई है. इसलिए हमारा बोर्ड हुआ स्टोर हाउस को कोई सवाल करना.
Sorry.
Thanks. I just wanted to ask about, can you have long COVID or symptoms like long COVID after any other viral illness or cold or flu? And if you do, what should you do?
Do you want to answer that? Yeah, go for it. So yeah, I mean, the definition of long COVID or post-COVID is symptoms specifically from having a positive diagnosis, or if there's no positive diagnosis, because not many people are testing now, but if it is similar to COVID, then yeah, we would kind of treat the symptoms we're seeing. As far as it coming after other viruses, like one example, Ruth I'm going to go out on a limb now. So with regards to the taste and smell, so that became popular because of COVID-19, but I'm aware that it's not specific to COVID-19 and there are actually other viruses that have caused loss of taste and smell, but obviously because of social media and everything nowadays, and it's COVID-19 is the latest virus, loss of taste and smell is associated now with that, but it's not specific to that. It has happened on other viruses before. Don't know if there's others.
There are some viruses that are associated with chronic fatigue, so things like Epstein-Barr virus. I don't know if you've ever heard of mono, but that is caused by Epstein-Barr virus, and there is definitely a kind of post-viral fatigue phenomenon which can happen with some viruses. I don't think it's very common after the common respiratory viruses that we've talked about today, apart from COVID. And I think it's also important to say that although long COVID is very serious, and some people with COVID seem to have symptoms for longer perhaps than they do with other viruses, the vast majority of people will still get better after they've had COVID. And even if you do have persistent symptoms with COVID, after you've had COVID, most of those people will get better. So there is a small proportion of people who develop COVID, a small number of the whole, who are left with symptoms that can go on for a long, long time, and that can be very serious. But in terms of the whole population, that number of people is quite low. I think that's fair to say. Okay. Anybody else got any questions? Thank you.
Hi. I wanted to know if there's any relationship between COVID vaccines and blood clots, like maybe leading to stroke, MRI, if there's any research. Thank you.
That is a brilliant question. Thank you for asking. So, there is definitely a relationship between COVID, being infected with COVID, and being in hospital with a serious COVID infection and blood clots. So blood clots in your legs, like something called a deep vein thrombosis, or blood clots in your lungs. So we know that if you are in hospital with COVID, then you are at a higher risk than the rest of the people in the hospital for getting a blood clot. The general population, so if you were not in hospital with COVID, we don't think that there is an increased risk of blood clots. In terms of heart attacks and strokes, we don't know, really, I think is the answer. I think because COVID was so common for such a long period of time, we saw a lot of people who were developing heart attacks and strokes at around the same time as they had COVID. And obviously a lot of the people who were in hospital, especially during the first few years of COVID, before we had vaccines, were very, very unwell. And then they may then have gone on to develop more serious complications of a serious infection like a heart attack or a stroke. So that can happen after you've had any infection with a virus or a bacteria. I don't think there's any definite evidence to say that if you've had COVID, you're at higher risk of a heart attack, or if you've had COVID, you're at higher risk of a stroke. But there does seem to be some association. So the two things had certainly happened along the same time, but it's hard to know if one causes the other. Does that make sense? There are a lot of theories about COVID specifically as a virus, and thinking that there might be something particular about the COVID virus that affects the blood and affects clotting. And one of the theories around why people get long COVID is that there are some ideas that it might increase clotting in very, very tiny blood vessels that we can't kind of measure very easily. So that's not like a big blood clot in your lung or in your leg, but it's very, very small blood vessels. But I don't think we know for definite. We're still learning. Does that answer your question? Yeah, brilliant. Does anybody else want to ask anything? Yeah. So if nobody else has got any questions, then I think we'll be sticking around for a bit. So if you want to ask anything to myself or to Chris or to the long COVID team at the back, or Dr. Muller's still here, Dr. Carl's here, please come and speak to us. We're very happy to be spoken to. You can take the oxygen probes home. I know there's only 4 of them, so you'll have to divide them up between you. And then obviously we've got the Living Well team here at the back, and also Genes and Health, so please go and speak to them and get your cholesterol checked, and you can have a blood pressure check and speak to Genes and Health if you haven't already. Thank you very much, everyone.
Thank you. Dr. Louis Wiggins, thank you. Dr. Louis, Dr. Muller, Dr. Khan. Muzammal at the back is a pharmacist.
Oh.
Muzammal used to be in our youth club, he's a pharmacist.
Hello.
Our friend, neighbor, and he's there to do our glucose test before, and of course our living well team is doing blood pressure test. Do not go home without having your blood glucose test and the blood test done. Certainly our genes team is here. And regarding COPD, as you heard from our doctors and our colleague, that we will be setting up a study. I know my team, my colleagues are here, so we will set up a study, COPD study session at Deeplish with different languages that we will contribute and part of our research. So, to say thank you, I think I need somebody like Steve, a community doctor. So can I call upon my great friend 20 years ago when I was becoming a passionate, trained community worker in this neighborhood, and I call upon my really good friend at that time, the director of Rochdale Council's community department. That was Andy Wiggins. Andy Wiggins has still the same passion, same young spirit. He's still connected with the Deeplish. Now the centers like Deeplish are open today because Andy, 20 years ago, was training ourselves. He was empowering communities. So can I call upon a community doctor rather than Ruth's dad, Andy Wiggins, to say thank you and a few words at the end of our session.
Yeah. Well, that was a bit of a drop me there. I've been called lots of things. Community doctor, actually, I like that. That's a kind of a nice idea. But what I think is most important about events like tonight is that the professional services that are here, from the hospital service, from the physio teams and so on and so forth, the university researchers, it's crucial that they're reaching out to the local community, because that's the way they learn, that's the way they improve services to us, or to us all. And so I suppose what I want to say is thanks to Sahil and the team, the management committee, for all the continued effort that you make. But I suppose make a plea to us, I'm retired now, and the people here locally, go back home and spread the word amongst your local friends, your family, and make sure that you use the fantastic services that you heard about tonight and contribute to the learning that needs to take place to make the world a better place. So do please take that message home, and I won't come next time because you won't drop me in it, will you? Thanks very much, everyone.
And so say really thank you to Dr. Louis' team of researchers, the consultants. I'm sure there'll be professors in future. So can I call upon Steve to say thank you to the team of our clinicians?
Okay, thank you. So final words from me. Just a huge thanks to everybody, really, the presenters in particular. So to Chris and to Ruth, thank you. It's been really informative. Thank you very much.
And thank you, like I said, now in between food and the test, my team is going to set the food up, and then in between that, so can we get people to get your glucose level test, the blood pressure test, and talk to our colleagues in the gens and health team. So thank you very much. And our next seminar is going to be on mental health. We're going to introduce.
When is it? We haven't got a date for the next seminar. It's going to be in spring, maybe around April time. Rachel's put her hand up, and this is Dr. Piyush Pushkar. Stand up, Piyush. So Piyush is a psychiatrist, and he is also a researcher at the University of Manchester. And Rachel is also putting her hand up. So Rachel's one of the psychologists. She works with the long COVID team. So hopefully they're going to be able to come and speak to you about mental health and any kind of mental health issues you might have. So if there's anything specific that you want to hear about for the next session, please ask one of them, and I'm sure they'd be happy to talk about it with you and maybe discuss it in a bit more detail next time. Thank you, everyone.
थैंक यू। आप अपने जो ना जो पीछे बहुत मुजुम्मल बैठे हुए हैं उनसे आप ग्लूकोज टेस्ट कर लें और ब्लड टेस्ट कर लें, तो थोड़ी देर में हम फूड लगाते हैं, फिर आप खाना खाएंगे, उसके बाद जाएंगे। थैंक यू।